Hi there, you're welcome to Mother and Child Hospital.
I'm Dr. Adeniyi, consultant surgeon, Mother and Child Hospital.
My name is Dr. Ikeja. I am a consultant obstetrician gynecologist.
My name is Promise Weji. I am the laboratory manager of Mother and Child Hospital.
I'm Dr. Olade, a family physician with Mother and Child Hospital.
My name is Mrs. Adeniyi. I'm the chief matron of the hospital.
My name is Dr. Felicia Adibayo. I'm a consultant pediatrician.
My name is Omolara Falola, the admin HR officer.
The vision that was started in 1996 by Dr. Raphael Olariwaju. He is a trained consultant gynecologist and had a vision to cater to the health care of mother and child. He shared a vision with his friend, Dr. Adeniyi. So Adeniyi has a PhD in engineering, civil engineering, but he has an great interest in taking care of people. So the vision started with the two of them investing both in finance and other resources.
Under antenatal, we offer women the best from the first trimester through to the third trimester and through delivery. And after delivery, we follow them up and we ensure that they get the best of family planning services such that they can adequately space their children and plan for the next delivery. And just before antenatal services are started, we also offer pre-conception care in the Department of Obstetrics and Gynae of this hospital. And our preconception care is to ensure that women are properly reviewed to check if there is any issues or problems that may affect the pregnancy going forward.
Mother and Child Laboratory is a diagnostic laboratory, a multi-purpose one for that nature, and we carry out investigations in places like hematology, clinical chemistry, medical microbiology, and the others. We also do monitoring for patients that are having treatment, can monitor whether they are responding or not. We also do things that have to do with screening. And like I said, it is open to both in and out patients. So they can come in for things like premarital screening, pre-employment screening, infectious screening. All these are done using our ultra-modern equipment. And these equipments have been able to stand the test of time. With this, our results are very highly confidential.
Basically, I see different kinds of cases in my pediatric practice, ranging from preterm babies, those who are born before term, to neonates, those are newborn babies, and we ensure that we follow them up, immunization follow-up, well baby clinics. Other common cases that we attend to here are respiratory illnesses, sickle cell patients on follow-up. Also see neurological illnesses such as seizure disorders. I also run developmental assessment for children with learning disabilities or some delay in their development. The other things we also see here are basically anything pediatrics, what we see here. And also we have a strong collaboration with other departments such as the pediatric surgery, the radiologists and other people that we need to work with very closely.
In the family medicine department of Mother and Child Hospital, we attend to all individuals, not considering their ages, and their gender, also not possibly whatever illnesses or disease they're presenting with. Our treatments are cost effective, they are comprehensive, and largely continuous.
To be able to mobilize and get our clients from place to place where necessary, we have an ambulance service that is highly equipped. In our ambulance service, we have ventilator, mobile ventilator, we have mobile monitor, we have defibrillators, we have oxygen, regular oxygen supply, and it's quite impressive how this has been very functional in moving people from place to place. So the hospital started small at number 39, Adeniyi, which we still hold on to today, with just a few staff. The number of staff has grown from the 5 that started to 108 at the moment. I'm glad to see that the growth has been quite rapid and quite impressive. When the hospital started, basically most of the people that used to come are the pregnant women. And as the number of children increased, there was a need and desire to have a pediatrician on ground. And so that was started, and we had good results. Parents began to have the desire to have their family coming with them, that as they come for treatment, they do not have to go other places to be able to have care. And so the hospital rebranded, and even though we did not change the name because the name has become a household name, but we rebranded to now extend our vision beyond just catering to mother and child only, but we now cater to the whole family. So we have a vision to have a comprehensive care for the whole family. So when the hospital began to grow, and like I said, there was need for other members of the family to have health care. So I was brought in as a surgeon. And at that time, we were able to operate across board. A man came in, collapsed unconscious, and nobody could give the history. But special tests confirmed that there was something in the brain, and was taken in within 24 hours. The brain was separated and he recovered and walked home. These are some of the things that brings us joy, that we can get people to have good care and go home at a very reasonable cost. We intend to spread this to other aspects of healthcare, and that's why we brought in the physician who now manages. We have a physician managing diabetes and endocrine diseases. We have a physician managing kidney problems, the heart problems. Although these are still not at where we're going, we still hope to get all the various specialists so that we can get our vision fulfilled. So we have a policy in the hospital that anyone who comes around, we try to do the best we can, even if there's no money immediately to care for them. What makes us very unique is the fact that we want to provide healthcare that is top-notch, that can be found anywhere in the world for the people who are not so rich. As it is now in this country, only the rich seems to be able to access very excellent healthcare. So we think that the middle class should have an opportunity to have the best of services that's available and providable anywhere in the world at a reasonable cost. So that's our primary vision.
They are prompt, just like our core values. We make sure that we stick to all this, and with this, you can be rest assured that you are getting the best from this place.
Our nurses are warm and welcoming, and they are ready to assist you throughout your medical journey in the hospital.
We are proactive in our approach to offering you outstanding healthcare services. we can also ensure that your complaints and concerns doesn't repeat itself again.
We are committed to what we are doing, and we are very, very sincere with integrity. That's what we stand for.
Would love to work with you. Our doors are open 24/7. I would love to have you. And I look forward to meeting every child that comes into the doors of this hospital.